Hey there, viewers! Good lips can make you stand out in a crowd. You can't have a nice smile without good-looking lips, but when you don't apply lipstick or lip balm, your naked lips could be revealing some hidden secrets about your health. In today's video, we'll be talking about 7 warning signs your lips are giving you. What could dry or chapped lips be saying about your health? Are they cracked at the edges? It could be an infection. What about lip discoloration? We'll be talking about all of this and more. Number 1. Dry and chapped. What's your first instinct when you have dry or chapped lips? You most likely slather on some lip balm, but that's not going to help if the problem is inside of the lip. If your lips happen to be dry and chapped, it means you're dehydrated. When you don't drink enough water during the day, your body will suffer and show many other signs that it needs fluids. But dry, chapped lips are one of the first indications you need more water. When you see you have dry lips, your first instinct may be to lick them and give them moisture. This is not the right move. You should try and resist this urge as much as possible. This is because your saliva will dry up your skin even more. Eventually, your lips will crack. If you don't drink enough water, chapped lips will soon be the least of your problems. People who are dehydrated can experience severe issues, such as low blood pressure and rapid heartbeat. If the situation gets worse, you might feel lightheaded with a pounding headache. Although you might be tempted to just use lip balm or lick your lips, this gives you only a short-term benefit. Your best solution is to hydrate yourself on a regular basis and avoid health issues as well as chapped lips. Number 2. Cracked at the edges. If you see that your lips are cracked only at the edges, it could be because of a yeast infection. This particular infection is usually caused by your own saliva. If you're someone who drools in their sleep or wears a retainer, there's a high chance of bacteria collecting around your mouth. The saliva can get trapped at the edges of your mouth, usually at the corner of your lips. This can cause your lips to crack. You might end up licking them a lot trying to get rid of the pain. As a result of all of that additional saliva at the corners of your lips, bacteria will find a warm environment to breed. Fungus like yeast will end up growing around your mouth area. You'll need to take medication for this, but it's a problem that can be fixed. Number 3. Discoloration. Any type of discoloration on your body can be frightening. Discoloration of the lips is another symptom that can be an important indicator of your health. It's important to notice the change in color as quickly as possible. Of course, discoloration can occur for harmless reasons, such as something you ate. Colored foods or candy such as lollipops can give you color. This can be easily removed by just washing your mouth. However, there can be more serious reasons for discoloration. This is something you'll need to look out for in case the discoloration does not go away after a few days. It could be something as severe as liver disease. While the skin on the rest of your body is made up of countless layers, your lips only have 3 to 5. As a result, the tissue is thin and delicate. So it's easier for the blood from the vessels underneath to come out and appear in the form of discoloration. The color your lips turn can indicate a problem as well. For instance, blue lips indicate there's not enough oxygen circulating through your blood. If the lips are white or pale, it could be a symptom of anemia. Other causes include personal habits such as smoking. People who smoke a lot tend to have a black discoloration of their lips. You can take the necessary steps needed to get rid of the discoloration based on the causes. Before we move ahead, here's another video you might like. Your skin and lips thrive on collagen, a special type of protein. Can you boost the amount of collagen in your body? Watch this video and find out. Now back to our list of 7 things your lips are telling you about your health. Number 4. Swelling. When your body parts swell, it's a sign that something is wrong. The size of swelling will determine how serious this problem is. In the case of swelling lips, it often happens after you've been hit in the mouth with something. But a more severe cause could be an allergic reaction. Your lips could swell due to inflammation. There may also be fluid that's built up under the skin of your lips. Allergic reactions to the environment around you, such as dust or pollen, can also cause swelling. On top of that, you may be allergic to pet dander. Experts suggest at least 4% of adults and 6% of children suffer from food allergies. Your lips will swell up as soon as you eat something you're allergic to. Nuts, dairy, shellfish, those are usually the foods that give you these allergies. If you're allergic to any of these foods, I'm sure you already know to stay away from them. Number 5. Paleness. If your lips turn pale, it could be because of anemia. The condition is due to a lack of red blood cells in your body. Either your body is not making enough red blood cells or it's destroying the ones that are present. It could also be because of heavy blood loss, such as the kind women experience during menstruation. Another reason for pale lips could be because of a deficiency in vitamin B12. If you want your body to produce enough red blood cells, you'll need to provide it with the proper B12. Considering this vitamin is not produced by your body, you'll have to get it through either food or supplements. Paleness in the lips can also be brought on through a lack of sun exposure. If that's the case, you should go out in the sun more, while using sunscreen to avoid the harmful effects of overexposure. Number 6. Tenderness. Sometimes you'll find that your lips are sensitive when you touch them. It could also be a bit of pink around the edges of your lips. This is because of the tenderness in your lips caused by allergic reactions. In some cases, the tenderness could be from severe allergies. In other cases, you might see that your lips are a bit inflamed. The inflammation or red lips could be from an allergy from non-threatening sources such as lipstick. It could even be because of a certain type of toothpaste you're using. The best way to clear this up would be to keep track of what's causing the allergic reaction. Once you identify the cause, you can eliminate that from your daily routine and not worry about the tenderness anymore. Number 7. Cold sores. If you see any redness or blistering near the mouth, it could be because of a cold sore. One of the common reasons for cold sores is herpes. You could pass herpes from person to person through close contact, such as kissing. The cold sore on your lip will usually last for as long as 2 weeks. After that, it usually crusts over. When the cold sore is visible, it's highly contagious. Even when it's not visible, herpes can still be spread. You may not even know you've contracted the herpes virus until 20 days after you were exposed. This is when the first sign of a cold sore appears. There are other symptoms along with the cold sores to worry about. This includes fever, muscle aches, and swollen lymph nodes. If not treated promptly, it could even lead to vision loss. Interested in learning more about your body and skin? You need to understand the subtleties first. For example, there are certain body changes that need your immediate attention. You'll also need to avoid certain foods if you want a younger looking skin. Here's what you need to know. Watch 10 body changes that need your attention. You can also try our video on 13 foods to avoid if you want younger looking skin. Go ahead, click one, or better yet, watch both and learn more about how to have healthier skin. Have you noticed any of these signs mentioned in the video? Let us know in the comments below.